Welcome to Your Health with Dr. Stephanie. I'm Dr. Stephanie Herodopoulos, and today the topic of discussion is postmenopausal bleeding. Postmenopausal bleeding is when a woman starts bleeding vaginally after a full year without a period. And this can be a very frightening and confusing experience. However, it is quite common, accounting for 5% of all gynecological visits, and it occurs in about 30% of postmenopausal women. All postmenopausal bleeding should prompt an appointment with your physician. While the overwhelming majority of postmenopausal bleeding is not caused by uterine cancer, it is considered that until proven otherwise. It is better to be safe than sorry, so make sure you make your appointment with your doctor right away and don't put it off. Early detection is key with uterine cancer since it has such a high survival rate if caught in the early stages. So after a detailed history and exam, you will then be referred for a pelvic ultrasound to check the thickness of the lining of the uterus. If the thickness is greater than 5 millimeters, an endometrial biopsy is indicated. And this is a simple procedure that is done outpatient setting in the exam room with a small instrument that is passed through the cervix and into the uterus. It allows for a sweeping of the inner lining of the uterus and the collection of a small tissue sample, which is then sent to the pathology lab for evaluation. Think of it as a deep pap smear. Postmenopausal bleeding can occur for a number of reasons that are other than cancer, and the most common cause is hormone replacement therapy or a change in your dose. The second most common cause are polyps and fibroids, which are benign, and also endometrial atrophy, which is due to the lack of estrogen. This causes thinning in the lining of the uterus and can cause the small blood vessels in the uterine lining to break down and bleed. Endometrial hyperplasia is a condition where overgrowths of the uterine lining develop. This can cause bleeding and sometimes can turn into cancer. Sometimes lifestyle and stress levels have an effect on the body, causing bleeding to occur. Dramatic weight loss after menopause can lead to estrogen normally being stored in the fatty tissues released into the bloodstream, leading to bleeding in the same way that hormone replacement treatment does. And emotional stress can cause bleeding. Many women have reported spontaneous bleeding at times of extreme anxiety and excitement. And although bleeding is often a little more than an annoyance or inconvenience, it should always be checked out by your physician due to the possibility of further complications caused by some of the conditions mentioned today. For more information on this topic and more health news, check out Your Health with Dr. Stephanie, which runs every Thursday in Florida Today's Health section, or visit floridatoday.com.